Welcome to this news conference of the Council of Federation.
This is how the premiers come together in the age of COVID, gathering virtually to send a message to Ottawa.
Our health system face a financial problem, a major financial problem.
A problem, they say, $28 billion a year in federal funding could help solve. An old demand packaged in a coordinated way with a clear target.
I raised the example with the Prime Minister of a young woman who felt a lump in her breast.
Premiers using personal stories to put personal pressure on the Prime Minister.
When I raised this story, a true story with the Prime Minister, he looked across the table at me and said, "I'm not your banker. I don't need a banker. We don't need a banker. Canadians don't need a banker. We need a partner."
In a statement, the Prime Minister's office said, "We don't know what the Premier is talking about." The Prime Minister worked collaboratively with premiers to have Canadians' backs through this crisis. Some of these premiers have cut taxes. Others don't have a sales tax. But they all say they can't make ends meet because of the federal government and warn it will get worse.
We have not any idea yet what the long-term cost will be for those who will suffer long-term symptoms from COVID-19.
The federal government isn't saying no, just not mid-pandemic, when it's already financing most of the country's COVID costs.
If COVID-19, and God, we all hope that's the case, is looking like it's in the rearview mirror this summer, that would be the time where the government of Canada would be in a position to say to them, this is the amount of money that we're prepared to spend.
The premiers were hoping, though likely not expecting, to get this money in the upcoming budget, the focus of which will overwhelmingly be on the crisis of the pandemic and the economic recovery. David Cochran, CBC News, Ottawa.